Are doxycycline and penicillin the same? No, doxycycline and penicillin are not the same. They are two different types of antibiotics that belong to different classes and have different mechanisms of action. Doxycycline is a tetracycline antibiotic, while penicillin is a beta-lactam antibiotic. Tetracycline antibiotics like doxycycline work by inhibiting bacterial protein synthesis, thereby preventing the growth and multiplication of bacteria. On the other hand, penicillin works by interfering with the construction of the bacterial cell wall, leading to the weakening and eventual death of the bacteria. Additionally, doxycycline and penicillin have different spectrums of activity, meaning they are effective against different types of bacteria. Doxycycline is commonly used to treat a wide range of bacterial infections, including respiratory tract infections, urinary tract infections, sexually transmitted infections, and certain types of skin infections. Penicillin, on the other hand, is often used to treat infections caused by gram-positive bacteria such as streptococci and staphylococci. Furthermore, each antibiotic may have different potential side effects and drug interactions. It is important to note that allergies to penicillin are relatively common, whereas doxycycline is generally well tolerated by most individuals. If a patient has a respiratory infection caused by Streptococcus pneumoniae, a penicillin antibiotic may be the preferred treatment option. If a patient has acne caused by Propionibacterium acnes, a tetracycline antibiotic like doxycycline may be prescribed. In conclusion, while both doxycycline and penicillin are antibiotics used to treat bacterial infections, they belong to different classes, have different mechanisms of action, and are effective against different types of bacteria. It is essential to consult a healthcare professional to determine the appropriate treatment option based on the specific infection and individual patient factors.